Good afternoon et bon après-midi à tous. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery. The button for this is located on the top right corner of the Zoom video screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite de poser votre question. Veuillez aussi changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along in the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Medical Officer of Health, and Councillor Keith Eglai, Chair of the Ottawa Board of Health. Nos porte-paroles aujourd'hui sont la Dr. Vera Etches, médecin-chef en santé publique, et le conseiller Keith Eglai, président du Conseil de santé d'Ottawa. Following the remarks, we will then take questions from the media. Je passe maintenant la parole au Dr. Etches. Please go ahead, Dr. Etches.
So this week, Ottawa's 4 school boards are announcing their plans for a return to schools in September. And I know many parents will be reading these plans carefully and considering what the best decision is for their family, in-person schooling or virtual education. Ottawa Public Health is working with the local school boards to implement provincial guidance to support infection prevention and control in schools. Plusieurs mesures de protection seront en place afin de maintenir au plus faible taux possible la transmission de COVID-19 dans les écoles, et elles ne se limiteront pas exclusivement à la réduction de la taille des classes et des cohortes. There are multiple layers of protection that are involved in keeping COVID-19 transmission in schools as low as possible. It's not limited exclusively to reducing class size and cohort sizes, but also keeping the infection level in the community overall low, screening of students and staff to allow for people who are ill to stay home, using masks and distancing practices, adapting schedules and student flow, and maintaining vigilance with hand hygiene, as well as responding rapidly to exclude close contacts when someone is confirmed to have a COVID-19 infection. So I continue to have regular conversations with Ottawa's 4 school boards. We're reviewing specific questions or providing feedback on their plans. We're planning for a variety of scenarios. Scenarios that would include someone having symptoms, if an individual has a positive COVID-19 test, and if there's an outbreak where it appears that the infection was transmitted in the school. We'll be actively practicing these scenarios in the coming weeks, getting parental input on the communications and the measures, and ensuring that school staff are equipped with the information they need to follow through on communications and other aspects of the protocol. So early detection and responding to outbreak clusters in schools will be vital for controlling transmission of the virus in the community, just as adult physical distancing and mask use will be vital to keeping the virus out of schools. So the surveillance systems will be in place to monitor potential cases and potential outbreaks. We know, given the size of the student and the school staff population in Ottawa, which is nearly 200,000 people, there will be people with symptoms similar to COVID-19 that will need assessment every day. Therefore, Ottawa Public Health is working with our healthcare partners to ensure that we can maximize our testing capacity, make sure that's available to rule out or detect COVID-19 in this population on a daily basis. Des systèmes de surveillance seront mis en pied pour détecter les cas et les éclosions potentielles. En raison du nombre des élèves et des membres du personnel dans les écoles d'Ottawa, environ 200 000 personnes, certains présenteront des symptômes semblables à ceux de la COVID-19 et des tests de dépistage devront être effectués chaque jour. Ainsi, SPO, Santé publique Ottawa, travaille avec nos partenaires du secteur de la santé pour veiller à ce qu'une capacité de dépistage maximale soit disponible pour le diagnostic de COVID-19. While this upcoming fall may feel uncertain, we're going to adjust, continue evaluating the situation, our responses, and continue to seek feedback about keeping this return to school as safe as possible. This is an important dialogue to continue to have with everyone involved, whether it's school boards, school staff, families, parents, youth, children, health professionals, and employers. Ottawa Public Health recognizes this need to balance the risk of COVID-19 transmission with mitigating the other harms to the well-being of children, youth, families, our broader community. We're all impacted when people cannot rely on schools to support childhood development and the economic activity that we usually have. Ottawa children and youth have not been physically present in a school since early March, and we know this has been stressful for many within our community. According to a recent report on the status of mental health in Ottawa during the COVID-19 pandemic, parents of school-aged children are reporting poor mental health and higher daily life stress than other subpopulations of Ottawa adults. And additionally, 2/3 of parents with school-aged children at home are concerned about their children's mental health and emotional well-being. So after the school and daycare closures in last March, parents were reporting that they were concerned about their children missing the social development. And we have more data now that the closure of non-essential businesses, schools and daycares, and stay-at-home measures that were implemented in mid-March led to unemployment, a decrease in job seeking, and income loss for people in Ottawa. And many individuals and businesses had to apply for emergency response benefits, subsidies, and payment deferrals. But to the parents of Ottawa, I hear you. This is a difficult decision for many parents, given so many variables and so many unknowns about the future. When deciding how to send your child back to school, each family needs to assess their own situation, their individual variables. Aux parents d'Ottawa, je vous comprends. La décision est difficile car il y a beaucoup de facteurs à prendre en compte et tant d'incertitudes quant à l'avenir. Chaque famille doit évaluer sa propre situation pour prendre une décision concernant le retour à l'école de son enfant ou de son jeune en septembre. So key factors in this decision include your child's health conditions, the close contacts of your child and their health conditions. There may be other family members at higher risk for serious outcomes of COVID-19 infection. Your family's ability to find alternate childcare and resources to assist in providing homeschooling will also play a major part in your decision. Perhaps your child has developmental needs that would require in-class learning with a trained professional. There's no right answer for everyone. This decision is one that must be made by each individual family. Every one of us doing our part today will support a safer return to school in September. And in the fall, employers in particular will play an important role. They're going to be adjusting to workers' return to full-time work with extra precautions to prevent transmission in workplaces. And we're calling on employers to be flexible to ensure that people are able to stay home when unwell or to care for a child, youth, or family member with symptoms of illness. Nous demandons également aux employeurs de faire preuve de flexibilité pour permettre aux personnes de rester chez eux si elles ne se sentent pas bien ou prennent soin d'un enfant, d'un jeune ou d'un membre de leur famille ayant des symptômes. So please continue to check Ottawa Public Health website for mental health resources for all ages. This is a stressful time. It's okay to not feel okay. We have resources available there. And we're creating a dedicated page, a web page for schools, colleges, and universities that will put more information forward about what to expect in the fall as children return to school and post-secondary youth. We are in this together. We will make it through this time of stress and uncertainty with a focus on keeping each other as safe as possible. Ce que nous faisons en tant qu'adultes, vous et moi, ça c'est important. C'est important de continuer nos efforts, de faire la distanciation physique et maintenir la protection pour éviter la transmission de COVID-19 dans notre population. Merci.
Merci beaucoup, Dr. Etches. We will now hear from Chair Eglai. Please go ahead.
Thank you. Good afternoon. Bonjour, Quay. Thank you, Dr. Etches, for your comments. As Dr. Etches just pointed out, and as we all know, the school boards have now released their back to school plans for the fall. Some of the health and safety measures announced by the school boards include strategies such as outdoor learning where possible, classroom cohorting, hybrid models where students are educated both online and in the classroom, remote learning, and more. Having said all that, this is an extremely difficult decision for parents to make. My children are not of that age anymore, and I don't have to engage in that discussion and decision-making process with them or my spouse. But I can tell you, when I'm out and about in the ward for the last couple of weeks, the number one question that people are talking about, that they're seeking support and information about, is the school question. Do I send my kids back or don't I send my kids back? And what sorts of things should I be looking at? And I firmly believe that Ottawa Health understands the complexity of the decision-making that has gone into the reopening of schools. Dr. Etches and her team have been and will continue to work with each school board to ensure that public health protocols are in place when children return back to school in a few weeks. OPH emphasizes with the feeling of anxiety and uncertainty that both the parents and the students might be feeling, and would like to reassure residents that OPH is working to ensure that mental health supports are in place as our children transition back into the classroom environment. We'd like to encourage parents to visit our webpage to access mental health resources, including information about how you as a parent can support your child, ways we can practice being resilient, and much more. And as Dr. Etches pointed out, there will be a dedicated webpage to assist with this very difficult decision. Students in Ottawa have been out of the classroom setting now for approximately 5 months since March of 2020, and we can see the negative impacts that this is having on the physical and mental health of our children and in the community of Ottawa as a whole. And we must balance the risk of the COVID-19 transmission with other observed impacts on the health of children, youth, families, and school staff. And again, I think that's where OPH comes in. We're looking at it through that lens. We're assisting the school boards, keeping that in mind, and hopefully, as indicated, acting as a valuable resource for parents as they have to make this decision, as I understand it, for the boards by the end of this week. So please reach out to our website, look at the information that's there, and use that in a way to make a fully informed, or as informed as we can be in these COVID times as you're working towards a decision. Thank you.
Thank you, Chair Eglai, and thank you as well to Archie for making a cameo appearance and being very passionate about this important issue. In the interest of time, I will quickly read through the list of media who have registered. There is no need to indicate you are present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits aujourd'hui. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas mentionné votre agence. Alors aujourd'hui, nous avons le 104.7 Outaouais, 1310 News, CBC Ottawa, CTV Ottawa, Global News, Le Droit, On the City from the Burbs, Ottawa Citizen, Ottawa Sun, Radio-Canada, Rogers TV, and TVA Gatineau Ottawa. Have I missed an agency? Est-ce que j'ai manqué quelqu'un? I see no hands raising. I will now invite each agency in alphabetical order to ask their question. Please remember, you have one question and one follow-up question or comment. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. First up, we will start with, nous passons maintenant à 104.7 Outaouais. C'est à vous. Euh, 104.7 Ottawa, alors on voit personne. On va passer 1310 News. 1310 News, the floor is yours. I see Deborah, who appears to have the microphone unmuted, but we're not hearing anything from our side. If you'd like, Deborah, you can email us your questions and we'll read them at the end of the Q&A. So in the interest of time, I will pass to CBC Ottawa, please. The floor is yours.
Thank you very much. Yeah, I'm curious about the scenarios that Dr. Etches mentions that you're practicing at this moment and in the coming weeks. Can you elaborate? What are some of those scenarios?
Lost the volume. You just went very quiet after the
beginning.
I'm
sorry. I'm sorry. Can you hear me now?
You mind repeating your question, please?
Yes, absolutely. I'm curious about the scenarios that you talked about that you're No?
Can others hear?
Is anyone else able to hear me?
Yes, we can hear you.
We can hear you, yeah.
Oh, okay. I hope so. I work in radio.
Dr. Etches, can you hear us?
It seems like my speaker source has switched to my headphones. So
okay.
I can hear you now. If you don't mind, it was about scenarios and you're curious about the scenarios.
Yeah, take us through what some of those scenarios are and not so much the scenario of what happens at the school, but what the reaction is from OPH and your recommendation to a school board.
Sure. So the Ottawa Public Health approach is always to focus on prevention first. So, working ahead of time with schools to make sure that the environment is set up to allow as much physical distancing as possible. And that starts from the time children enter, looking at the flow of children, looking at the cohorting that's done in classrooms. So we will have public health nurses assigned to schools, and they will be, providing more detailed guidance if is needed, addressing questions related to all these measures to prevent transmission. We also are reinforcing the importance of the screening, and we'll be working again with parents to make sure they understand what does it mean to screen your child every day to make sure that there aren't any symptoms of COVID-like illness. And so that's one of the scenarios is working through, well, what if it's just a headache in a child, or what if it's a stomach ache? What does that mean? So helping parents understand in those situations how you would handle that, that we are wanting to be very cautious as we go forward, that any mild symptom that previously may not have been a concern, we want to think twice about that. So really practicing that and working on the communication so parents understand what it means to do that screening and then keep children home when they need to keep children home. We similarly, of course, are making sure that it's very rigorous screening with the staff in the schools. After that, it becomes a scenario of looking at our surveillance data. So what is school absenteeism telling us? What if we see one child who stays home? What if we see 3 children who stay home? So working that through in terms of reaching out to families and what scenarios would we reach out to see if they have pursued COVID-19 testing, or we recommend COVID-19 testing. We'll be looking at the scenarios, for example, when there's a positive case that comes back. It really is case by case that public health will be assessing where was the likely source of exposure to that case. Most children's infections come from their family, adults in their family. And so that, those are close contacts in the household, working through how family members then would pursue testing and, what the scenarios are in the classroom for communicating that this has occurred, there's a positive, and we need to take the precautions of close contacts staying home. We want to look at the supports for people to stay home. So we have been looking at and confirming with social services if somebody's going to face hardship by having to stay home, what supports are there, and again asking employers to do their part to make sure all of us keep transmission as low as possible. The scenario where it looks like we're meeting the definition of an outbreak, which would be 2 cases in a school where there's a link between them, then that's another time when we would be practicing, what communications, what steps need to be taken in order to investigate more broadly where that transmission could be coming from. So those are the kinds of things walking through. There's communications involved, there's follow-up involved, there's the tracing of the contacts, and looking at other processes in the schools. We have these response teams that will be joint, so schools and public health working together to make sure that the actions that need to be taken are taken. And then, of course, the feedback and the evaluation when we have something that where we needed to do additional response, we want to continue to learn and always improve if that's needed.
Appreciate that. And just a quick follow-up then, because you mentioned about public health nurses that would be assigned to assist with the school boards. The province announced 500 additional ones. Can you clarify for Ottawa what that means? And have you got those people on staff yet? Is everything lined up yet, or is what needs to be done still?
Sure. Ottawa Public Health has a school health team, and we have nurses who are used to working in schools, very, very experienced, and we have a manager who's a strong ongoing relationships with school boards, and so we've been working and meeting weekly for a long time on plans. What we're doing is hiring more nurses. So we just got some communication that it's likely the number of nurses that Ottawa Public Health will be hiring under this new initiative to provide support would be about 36. And so we've already posted positions and are hiring.
Thank you very much.
Thank you. We will now take questions from CTV Ottawa. CTV Ottawa, the floor is yours.
Hello, everyone. Can you hear me okay?
We can hear you.
Okay, excellent. So my question, I guess, is first for Dr. Etches. Just based on the data that we've seen of COVID spread so far in Ottawa and the cases that have involved childcare spaces already that we've seen recently, do you have any projections or models for what you expect to see, excuse me, upon a return to school? Do you have any ideas of whether this would be a case of a lot of new cases? Do you have any kind of projections or models on that?
We are working through these kinds of questions with our provincial public health partners like Public Health Ontario, and what we know is that there will be more children with symptoms that need investigation than there are children with actual COVID-19 infection. And so, this is what I was trying to get at in my statement earlier. This is not a hypothetical. There will be children with symptoms where we need to do this assessment and keep people out of school and determine if it's COVID, and there will be COVID cases. So we know that we can anticipate that. It depends on how well we do over the next few weeks. Our actions today make a difference regarding the level of infection in the community. And then that in turn affects how much the risk is there to introduce it into schools. So it really is still in our hands, but I am sure that we will see a case of COVID in school. Most likely it will be due to an introduction from outside the school. And what we are working hard to do, make sure there isn't transmission in the school after that case is identified. And so that, again, there's many measures in place to decrease the risk of transmission within schools, but it does start with what we're doing today in the community.
Okay, thank you. And just a few moments ago, you mentioned going over absentee lists. Is this something that you'll be doing where the school boards will be providing you with lists of students who are absent frequently or semi-frequently, and then you will be calling those parents or those families and following up to check with them? How's that going to work?
Yes, so we will have that collaboration as we usually do. We often, in a regular year, would be working with schools around absenteeism and getting reports from schools about levels of absenteeism. So this is taking it to another level where we would be doing some of that active investigation and follow-up if there's absenteeism due to illness.
All right, thank you very much.
Thank you. We will now be taking questions from Global News. Global News, the floor is yours.
Thanks very much. Just looking at some of the Ontario-wide numbers, today we heard that Toronto had some of its numbers scrubbed down, reallocated, or faulty tests removed. And we've had some minor discrepancies in the past 2 days between OPH figures and Ontario. It's just like one case. But I just want to maybe get your comment, Dr. Etches, on what is the confidence right now in the in OPH's coronavirus reporting system? How robust is it, and how much stock can we put in the daily reports that we get?
So I do recommend that you use our dashboard, the Ottawa Public Health COVID-19 dashboard, which is updated daily directly from the system. So sometimes there's a case reported to us, and then when we do our investigation, it is from a different jurisdiction. So that case gets removed out of the system. It's allocated somewhere else where the person lives. So the numbers are dynamic. They do change. But what the dashboard does, it gets away from what's reported one day and the next day, going from 6 to 21 back to 6. It feels like it's jumping around. The dashboard allocates them based on when people first got sick, or the symptoms first presented, or the earliest date we have. And so that gives a better picture of when are these infections starting in our community. And you can see that is more stable over time. We did have doubling of the cases in July, and then doubling again in July. That rate of increase was very concerning to me. We can't continue to have doubling of cases every week without getting into dangerous territory. But we have not seen that continue in August. So we are seeing, a bit higher on average number of cases per day, but stabilized at that higher level. So I encourage you to continue to use our dashboard. There's no one measure that tells us about the situation of COVID in the community. So hospitalizations is very important to look at. That's the serious illness that arises in people at higher risk. Can happen in any age, but tends to be older adults. And that is a measure of what's happening. That's what we're worried about with more transmission in the community that reaches more vulnerable populations. So, and that intensive care unit admissions is also on the dashboard. Another interesting metric for me that I monitor is the number of contacts that people have when we identify somebody who's infected, and they let us know about who's a close contact. That number has risen. If people are in close contact with others more than they were previously. And yet, this is where I want to communicate, as adults still continuing to keep our contact as low as possible is still important going into school. It's more important than ever. I have heard that some people think, oh, it doesn't matter anymore because our kids are going to be mixing. But that's not the case. It's more important to break the chains of transmission between adults, as adults are likely the source for children, bringing it into the schools. So I'm getting a little off topic on a long response. But anyway, the dashboard's important. And so what we use is an overall color to try to convey the risk level in our community. And it's orange. So we're not in yellow because we still have outbreaks that are arising commonly. We don't have rare outbreaks. We still have outbreaks arising, and we don't have so that kind of lower level of cases that we had previously. So we're orange. We're in pay attention, take care. We're not in red, which would be where we would head if we had doubling of cases all of the time, taking us higher and higher into places where our healthcare system could be overrun. So I like to use the color also on the dashboard as a bottom line, picture of what does this mean.
You don't apologize for going off topic. You're saying the important things that need to be said. But you did mention there the topic of people are saying, physical distancing doesn't matter when our kids are in school. Can you maybe just speak to why are social circles still important going into the school year?
So the infections that children get are typically from their close contacts, and their closest contacts are their household contacts. If you move that to put 2 families together, 3 families together, and that close contact grows, that increases the risk of infection in a child or youth, and then that can be introduced into the schools. And so it really is about keeping the possibility for transmission into families in the community as low as possible. And that will help reduce the introduction of the virus into schools, where then we could see transmission if we're not careful.
Great, thanks very much.
Merci. Nous passons à la prochaine question qui viendra de Le Droit. Le Droit, la parole est à vous.
Oui, merci. Dr. Etches, il y a des critiques du plan de retour en classe du gouvernement provincial qui s'inquiètent notamment du nombre d'enfants qu'il pourrait y avoir par classe lors de la rentrée. Est-ce qu'il y a des éléments, dans le fond, de la façon que ça va fonctionner qui suscitent votre inquiétude ou qu'il va falloir surveiller particulièrement?
C'est important d'utiliser beaucoup différentes méthodes de réduire le risque de transmission dans les écoles. La distanciation physique, c'est une méthode importante et on sait qu'avec 1 mètre entre les enfants, ça protège, ça diminue le risque de transmission de COVID-19 si c'est moins de 1 mètre. Et quand on augmente la distanciation entre les enfants avec plus de 1 mètre, ça aussi protège, ça fournit plus de protection. Alors, ça, c'est une mesure. Mais aussi, l'utilisation des masques, ça, c'est efficace de réduire le risque de transmission. Toutes les autres mesures de prévenir l'introduction de COVID-19 dans les écoles aussi, avec le dépistage, les questions, la surveillance avant les enfants et les employés entre les écoles, ça aussi c'est vraiment important. Et aussi, si on peut répondre, d'avoir une réponse rapide après, il y a un cas de isoler les contacts, ça c'est aussi important. Alors, il y a différentes mesures et c'est pas juste un facteur qui est important pour la protection contre la transmission de COVID-19 dans les écoles. Alors, on travaille avec les conseils scolaires pour aider avec l'implémentation de mesures qui viennent de la province, de réduire le risque de transmission le plus possible.
Merci. Et puis, mon autre question, ça serait concernant, il y a une initiative, le Blitz pour le logement, qui a été annoncée hier par la Ville d'Ottawa. Puis, j'étais curieux de vous entendre un peu sur l'importance que va prendre la question du logement dans les prochains mois pour contrôler la transmission du virus, pour éviter que finalement arriver à le contrôler.
J'apprécie les efforts d'augmenter les options pour personnes d'avoir logement parce que les personnes sans abri maintenant ont plus de distance entre eux et aussi on sait qu'il y a des gens qui habitent dehors maintenant et c'est plus difficile dans l'hiver. Alors oui, c'est important d'augmenter notre capacité d'avoir plus de distance entre les gens sans abri dans l'automne et l'hiver.
Merci.
Merci. The next question is for On the City from the Burbs. Susan Sharing, if The floor is yours. I don't think Sue is here at the moment, so we will pass on next to the Ottawa Citizen. The Ottawa Citizen, the floor is yours. I think we have Joanne from the Ottawa Citizen. It appears your microphone is off mute, but we aren't hearing anything on our side. If you'd like to please email your questions, we can read them at the end. In the interest of time, we will move on to the Ottawa Sun. Taylor Blewett.
Hi, this question is for Dr. Etches. I was looking at the COVID-19 testing criteria info on the OPH website, and I see that now you're recommending that asymptomatic people only get tested if they're close contacts of a confirmed case. So I know the message before was, if you're concerned you've been exposed, you can go get tested. Wondering why this has changed, and how do people know if they're considered a close contact of a confirmed case? Like, will they hear from OPH?
Yes, if you are a close contact of somebody who has been infected with COVID-19, you will be contacted by Ottawa Public Health, and we're contacting people within 24 hours of being given that information, and recommending everyone's tested. But you have to wait for 5 days after being exposed for us to have confidence that if you were infected, the test would pick it up. So there's a timing issue there about when you present for testing. The option is still there for people who have a concern that they might have been exposed to present for testing. That hasn't disappeared, but we're emphasizing where it's most valuable, because we want to make sure that people who are most likely to need to rule out COVID with symptoms, are able to access the test. So this is a situation we have to continue to look at very carefully in terms of the testing capacity we have going into the fall, as students and family members and teachers are going to want to rule out COVID if they have symptoms. We're going to need to emphasize when does it really make sense to be tested, and when are you really lower risk? And we'll continue to direct people around that.
Great, thanks. And looking on the dashboard, the indicator that shows the time it's taking between testing and the reporting of a positive result to OPH. And my understanding was that, in 33% of cases, it's taking more than 48 hours. So I'm just wondering, is that something OPH would like to see improved? And if so, is anything being done to kind of try to shrink that time frame?
Yes, so absolutely. The faster we get a result, the faster we can follow up with cases and contacts. So we're interested in continuing to work with our laboratory partners to have the fastest turnaround times we can. The labs are adding capacity. They continue to do that, and so it does vary from lab to lab, and depending on where they are at and their staffing levels, and bringing new machines online to be able to process more tests. So we are in touch with the laboratories, and we're continuing to explore how we can support them.
Thank you. We will now move on to Radio-Canada. Radio-Canada, c'est à vous.
Oui, bonjour. Ma question est la suivante. On peut observer quand même plusieurs personnes qui ne portent pas le masque ou encore qui le portent incorrectement dans certains lieux publics, là, comme par exemple le train léger ou encore les centres commerciaux. Pourquoi on ne leur donne pas d'amende si le masque protège, oui, la personne qui le porte, mais aussi là, les gens autour?
On continue de discuter l'importance de porter des masques correctement. Ça, c'est vraiment un autre niveau de protection contre la transmission de le virus. On peut continuer à utiliser différents chaînes pour partager cette information. C'est une question, on continue de renforcer l'importance de l'utilisation des masques, par exemple, dans les appartements. La semaine passée, on a partagé une lettre avec des immeubles comme ça, et on aussi renforce l'idée pour les employeurs et partout dans la ville bientôt. Bien sûr, nous avons un règlement où c'est important de porter des masques dans les lieux publics. Alors, ça c'est une mesure. On fait des sondages de mesurer qu'est-ce qui se passe, et aussi on a vu une augmentation dans le pourcentage des gens qui portent des masques. C'est la grande majorité maintenant qui portent des masques dans les lieux publics.
Merci. Puis également, j'aurais aimé vous entendre en français sur la question là, des parents qui s'inquiètent pour la santé mentale de leurs jeunes et leur développement, puisque ça fait quand même un moment qu'ils ne sont pas retournés à l'école. Puis également sur les tests là, qui vont probablement être effectués si un jeune a un symptôme là, aussi minime soit-il comme un mal de tête.
Oui. Alors, je pense que je comprends votre question. C'est concernant la santé mentale des enfants, mais aussi dans la situation où il y a un symptôme et peut-être ils ont besoin d'un dépistage. Ça peut être stressé.
Oui, c'est ça.
Question? Oui, heureusement, nous avons un processus plus facile pour le dépistage maintenant. C'est pas important de utiliser un dépistage vraiment invasif. On peut utiliser un dépistage juste dans la gorge, par exemple. Et oui, avec notre partenaire à CHIO, on a des bons employés là qui aident avec les dépistages dans une méthode vraiment accessible pour les enfants.
Merci. The next question will be from Rogers TV. Rogers TV, we're going to move on to TVA Gatineau Ottawa. Alors la prochaine, TVA Gatineau Ottawa, c'est à vous.
Oui, bonjour. J'aimerais vous entendre concernant le virus du Nil occidental là, qui a été détecté à Ottawa, de savoir dans quelle proportion, est-ce qu'il y a des conseils également là, pour les gens pour éviter là, que ça se propage?
C'est presque 25% de les cas à Ottawa qui n'a pas une source identifiée. Alors, ça, c'est évidence de transmission dans la communauté. C'est similaire pendant tous les mois de cette pandémie, ce pourcentage. C'est pourquoi c'est mon recommandation pour chaque personne de vivre avec soin, d'utiliser les masques et faire de distanciation physique parce que nous avons la transmission dans la communauté. Alors, ça continue. Et aussi, le nombre des cas identifiés par un dépistage, c'est juste une portion, un pourcentage de tous les cas qui existent dans notre communauté. Alors, ça renforce l'idée qu'on a besoin de prendre soin encore.
Juste préciser, ma question était concernant le virus du Nil, les maringouins, les moustiques.
Ah, je m'excuse.
Pas de problème.
C'est trop COVID. Absolument. Nous avons un site où on a identifié le virus de West Nile. Absolument. Nous n'avons pas de cas de West Nile dans les humains à Ottawa à ce point. mais ça indique que le virus est ici. Et c'est important d'éviter les musiques qui piquent pendant certaines périodes de la journée, le matin, la soirée, aussi d'utiliser un insecticide s'il y a un risque d'avoir une pique de moustique.
Est-ce que cette découverte-là, est-ce que c'est quelque chose de nouveau? Est-ce qu'on observe ça régulièrement, la présence du virus du Nil? Est-ce que c'est inquiétant?
C'est similaire que les années passées, qu'il y a certains lieux où on identifiait le virus du West Nile dans notre communauté, mais le nombre des cas dans les humains est faible, était faible les années passées, mais c'est possible. Le virus encore, c'est comme avec COVID-19, c'est pas toujours une maladie vraiment sérieuse pour la majorité des personnes infectées, mais pour certaines personnes plus vulnérables, ça peut avoir des effets sérieux. Alors, on peut faire des actions de prévenir le virus, l'infection, et c'est temps d'annoncer que c'est ici et de faire les actions de protéger contre le virus de West Nile.
Parfait. Merci beaucoup.
Merci. We have received questions from Joanne from the Ottawa Citizen. Just before I read them, Joanne, would you like to try one more time using your microphone? I will proceed with reading the questions. So Dr. Etches, Dr. Malakny said in a statement on Friday that OPH wants classroom numbers to be, quote, as low as possible, but did not release any numbers. Other public health units have also released similar statements. If numbers are not used as a metric, example, X number of students in a classroom, are there any other metrics that can be used, such as meters of distancing?
Yeah, so I appreciate it. It makes sense that the numbers are part of the picture, right? Because the fewer the children in class, the more distance between them. So it doesn't depend on the physical layout of classes, what that space is. So it's hard to come up with a specific number. The distance between children, we know it makes a difference if it's 1 meter compared to less than 1 meter. But it's also greater protection if it's more than 1 meter. So that's why we say as much distance between children as possible. You know, this is one of the protections that we are reinforcing is important to set up in schools, but it starts outside of schools. There's different layers of protection where we need to first of all keep COVID out, and then make sure other barriers to transmission are in place, like keeping people apart in cohorts, in the flow, and using masks is another important one. So hand washing, the basics are still part of what will add up to more, you know, barriers to transmission in schools.
You've partially addressed this in your response, but I will read the follow-up question that was submitted. 2 meters of physical distancing is recommended. Is 1 meter of distancing workable in a classroom as long as other measures such as masks and hand hygiene are utilized?
Yeah, some of this in terms of the details of what's workable in classes, it's better answered by the school boards. But my understanding is that most school boards are able to reach that at least 1 meter, at least threshold. Absolutely, adding in masks and the hand washing, those at the screening at the beginning to make sure people who are ill stay home. Those are all things that add to the protection.
Thank you, Dr. Etches and Chair Eglai. We are concluding this press conference today. C'est tout le moment que vous avez pour le point de presse. Thank you very much. Merci à tous.